everybody. We are glad that you've taken the time to join us today. We're going to be talking about subsidy policy changes that were just instituted last Friday when we issued emergency rules. We're going to talk a little bit about the process that we went through to develop those rules, the important elements of policy that they touch on, and what the process is from here. We had to go into emergency rulemaking simply because of the timelines involved to ensure that the important services for families, in particular 12-month eligibility, the 5% subsidy requirement for quality improvement awards, and the base rate increases that were negotiated last year all went into effect on time. But as we'll explain throughout the presentation, we have a great opportunity for all of you to weigh in on these rules through a very formal and proper public rulemaking process. So with that, I'm going to turn it over to Matt to talk about some of the details in the new rules that were issued last Friday.
All right, so on Friday, July 1st, we published a set of emergency rules with the main purpose of implementing the Early Start Act, but also implementing elements of CCDF reauthorization that the state needs to comply with, and then also to implement base rate increases that were driven by negotiations in the collective bargaining agreement with SEIU 925. And the reason we file these as emergency rules with immediate effect is because a typical permanent rulemaking can take anywhere from 3 to 6 months or more, and there was a lot of coordination and a lot of changes that needed to be implemented working with DSHS, and that simply made the full rulemaking impossible to accomplish by the July 1st deadline. However, the emergency rules are temporary in effect. They're in effect for 120 days. And in the meantime, we have filed nearly identical rules as proposed rules so that the public has an opportunity to comment and weigh in and understand the full impact of everything that's going on there. So what's in the emergency rules we just filed? One of the most critical elements from the Early Start Act was 12-month eligibility. Now, we've always had 12-month eligibility periods in Working Connections Child Care Program. However, families could be terminated at any time during that 12-month eligibility period for things like loss of a job or exceeding the program's income limit, which is 200% of the federal poverty level. So what's critical and crucial about the Early Start Act's approach to 12-month eligibility is that there are very limited reasons for which a family can be terminated. So mom or dad loses the job, that's not going to cause a termination during the 12-month eligibility period. If the family exceeds 200% of the federal poverty level, that also won't cause a termination. The idea here is that we want the child to have that nurturing relationship with the provider, helps them be ready for kindergarten, and we don't want to interrupt that. So some of the few remaining termination reasons would be exceeding the absolute federal limit of 85% of the state median income. That's about 300% of the federal poverty level, so a much higher threshold. We're simply not allowed by federal law to provide CCDF funds and benefits when a family exceeds 85% SMI, so that's why that requirement is in place. And then recently the federal law requires that families can't exceed $1 million in resources being things like property, real property. So we don't expect many, if any, of our families to exceed that, but we did need to institute rules that would provide for that possibility. So the emergency filing contains that. So along with this 12-month eligibility and the protection from being terminated, we've eliminated a lot of reporting requirements. This was required under the Early Start Act as well. So families don't need to call up DSHS and say, oh, I got my hours cut, and then DSHS reduces their care benefit. They don't need to let DSHS know if they're losing hours. The idea, again, being we still want that child to have that access to care with the quality provider. We do still need families to report to us about convictions that family, friends, and neighbors providers might newly have on their record, or other people living in the home where the care is taking place. That's a critical health and safety component that we still need to have them families reporting on. And we do need families to report when they're changing their providers, so that DSHS can change over the authorization for care and have that all set up without any issue. So next slide. Oh, thank you. So as I was saying, families don't need to call up and report that the parent has lost work hours. And what that means is that authorizations, generally speaking, aren't going to be reduced. Meaning, if a family has a full-time authorization of 23 full-day units, even if the parent loses the job or gets their hours cut, they're going to keep that, and it's not going to be reduced. The only exception to that is with regard to school-age kids. We know that when school lets out for the summer, the care need increases because the child is not in school, and so therefore the authorization needs to increase, and we wanted to provide for that to happen automatically so that families don't have to call up DSHS. DSHS knows that they have a school-age child and that there's going to be a need for additional care. However, once the school year starts up again, we want to reduce that authorization back to the appropriate amount that it was before summer happened. And so we provided for that in the emergency rules. Finally, and possibly most importantly, what these emergency rules do is decouple a provider's billing from the parent's work schedule. We have to do that because if we're going to allow families to keep the care benefit even after a parent loses the job, we can't be requiring that the provider only bill during work hours because there might not necessarily be work hours. Again, what we're concerned with is the continuity of care and the child's access to that quality provider that's going to get them kindergarten ready. So also under this filing, we're providing for what's called a graduated phase-out. This is required under the CCDF reauthorization, the idea being that when a family goes to reapply for working connections or seasonal child care and they're over income just a little bit, we don't want to just have them hit a cliff and lose all eligibility for the program. The federal law requires us to phase them out gradually. So what we've done in Washington with this filing is to say, once that year eligibility period is over and the family's reapplying for benefits, if we take a look at their income again at that point and they're between 200% and 220% of the federal poverty level, they're not going to get terminated immediately and hit that cliff. We're going to give them a 3-month authorization while they transition and prepare for the private pay world. And then by the end of that 3-month period, for some reason, if income is going down again, they can let us know, and they can be eligible again for another 12-month authorization.
Before we move on to the next subject, there's a lot of complications here with 12-month eligibility, and I look forward to the Q&A portion of this presentation to answer your questions. But I think we ought to take a moment just to celebrate the fact that with the implementation of these rules, we've just injected an immense amount of stability for families and providers across Washington State. We have far fewer regulations for them to follow when it comes to keeping people in high-quality care. And this is a really significant milestone in Washington State's history in terms of working with these families. And so for the advocates and the legislature and the governor and everybody that supported this, this is a significant thing.
Agreed. So next component is a requirement from the Early Start Act. This is regarding quality improvement awards. When providers are rated quality levels in early achievers, we want to reward them for that and incentivize their continued progression through it. However, the Early Start Act did make a statement that we want to reserve those awards for providers that are helping out subsidy children, at least to some degree, and that's a 5% requirement. So we provided for that in the emergency filing. What the rules say is that a provider needs to serve 5% of their total license capacity averaged over the year subsidy children. So, for example, if a provider had a license capacity of 10 children on average for the year, they need to be serving at least one child about half of the months in that year to meet that minimum 5% requirement. Of course, the more subsidy that we can encourage providers to serve, the better it is for everybody. So we provide for that in the filing.
And one of the things that the staff here that we all worked on very hard was because the Early Start Act did not provide a lot of detail on the 5% rule, only that one be implemented. We worked very hard to try to develop a rule that provided as much grace to providers as we could, but still meet the mandates of the Act.
Right. And we knew that license capacity didn't necessarily reflect all the children that a provider might provide care for. So it's a soft requirement, but we're still complying with the Act and having it, be an actual, not nominal requirement. Another big accomplishment that we're implementing with the, if you move to the next slide, thank you, Genevieve. Another big accomplishment is implementing the base rate increases. So in the last bargaining session with SEIU 925 and in our reopener bargaining, we negotiated increases and we've also applied them to center providers. So both licensed centers and family, friends, and neighbors providers will get a 2% bump in all the base rates. And then for licensed family homes, a major accomplishment of the recent negotiations was to actually tie those rates once again to market rates in their different areas. And we had rates that were all over the map in terms of their fidelity to what providers actually charge in the real world. And that's incentivized certain kinds of care and disincentivized other kinds of care in a way that probably was serving kids the best. So I think we've made a major accomplishment there. What we've done is our goalpost is 75% of the market rate. So we're trying to get our subsidy rates to be somewhere around the neighborhood of 75% of what's charged in the private pay world. What we're accomplishing with the filing is to say that if a provider is rated level 3 in early achievers and is getting tiered reimbursement, that tiered reimbursement plus their base rate puts them at 75% of the market rate. So a quality provider will receive 75% of the market rate regardless of the age of child they're serving or the region in which they're providing care. So lastly here, I'll just talk about our next steps in rulemaking. As I stated before, the emergency rules are temporary in effect, just 120 days. And in the meantime, we have the full formal permanent rulemaking procedure. Let's see, yesterday we filed proposed rules. And so what that means is that the public gets a chance to comment formally, and then Dell takes into consideration those comments and formally replies to them and considers potential changes to the proposed rules in response. So the comment period will last from July 20th through August 10th. During that time, the public can make comments by emailing the DEL rules coordinator at rules@del.wa.gov. There will also be 2 public hearings on August 9 and 10 in the eastern and western parts of the state, where folks can come in and provide public comment in person, and those comments are recorded and formally responded to, just like written comments we receive. We also accept fax and mail comments, but most of the comments we receive these days are by email. So once we finish up those hearings on August 9 and 10, then we take a little bit of time to consider the feedback we've received and incorporate it potentially as changes to the filing. Then finally file these adopted rules, and then no more than 31 days later, they would go into effect. So I think we're looking at a September effective date for the permanent filing. In the meantime, the emergency filing is in place. So that was,
yeah. Thank you, Matt. That was a lot to take in, but we'd like to reserve the rest of the time for your questions if you have.
So if everyone can type their questions in the question pane, I'll go ahead and read them out loud one by one, and Matt and Frank will answer them as best they can. So we have a question: how are the regional base rates set, and are they regularly reassessed?
So all the base rates, I'll give this one a shot. All the base rates at one time were set based on the market rate survey. I think the last time was back in 2009, and then in the time between then and now, we've had lots of just static percentage rate increases, and then of course the market has changed a little bit. So in the meantime, things had gotten a little off. Like for example, infant rates in King County might be well below what a provider would charge in the private market, and well below what they might feel supports their business model. So unfortunately, with regard to centers, we are still in that world where those rates are a little bit skewed, but we had a major accomplishment with the licensed family home rates that they're now set to the most recent market rate survey in 2015. And then the idea would be that we would continue to track the market rate if we're funded to do so regularly when we have market rate surveys that come out. And of course, we would, there's always an interest in getting the centers back in line as well.
Great. Which market rate study is the 75% based on, and is it applied according to region?
So it's a study that's conducted by WSU. I want to say every 2 years.
So yes.
And the most recent was completed June 2015. So we would expect another one June 2017. So that's what we track to. And what was the second part of the question there?
Is it applied according to region?
Right. So with regard to the licensed family homes, we did look at every region, 1 through 6 plus Spokane, and move the rates closer to that 75th percentile of the market rate. So yes, each region and each child age category is set for licensed family homes to the market rate study, 75th percentile of the market rates in that study.
Matt, can you repeat the email address that people should use to comment on the rules?
Sure. It's rules@del.wa.gov.
Thank you. And just to remind people, if you can type your questions into the question feature. I know there's a hand raising feature, but we're just going to go ahead and have you type your questions in. So let's see. What are the plans to look into a true cost of care model versus the market rate study?
There's actually work going on. Excellent question. There's work going on here by Dell and some of our partners to develop a cost of quality matrix where we actually reflect what it costs to deliver quality education to our earliest learners. And then we would hope eventually to have rates and reimbursements pegged to what it actually costs to produce quality and to deliver quality to our youngest learners.
Great. Is there a projection of how the market rates are anticipated to be updated every 2 years, tied to that study?
I'm not sure I'm following the question.
Dee, do you want to maybe rephrase your question and we can try again? So Matt, can you go over again how the 5% rule applies, the calculation for it? Can you just review that again?
Sure. And I will try not to forget the last question that I probably misunderstood. But with regard to the 5% subsidy, what we'll do is look at the average license capacity for a provider for a 12-month period prior to the rating. And we'll look at the number of subsidy children that provider is serving on average for the 12 months. We will exclude any month that the provider was not open for business at least 1 day in that month. So if you took, for example, a provider that was open for 10 months in a year period and they had a license capacity of 10 children on average for the 10 months that they were open, then they would need to serve, 1 child in 6 of the 12 months to get to that, 1 divided by 20 or 5% minimum threshold.
Great. So going back to the question about market rates, is it possible for folks to be able to see the market rate charts and how the levels were determined?
The market rate survey is available online. we could probably supply a link to that after the webinar. And then the new rates are published in the Washington State Register and are available on the www.ledge.wa.gov site where the WAC is posted. You have to hunt a little bit to find a new filing in the new filings section, so I can provide links to that after the webinar as well. And then hopefully by July 20th here, the state code revisor's office will have the full WAC available with the emergency rules on the website. And there you can view the base rates and see how they compare to the market rate survey.
We'll make sure to get the links out to everybody. We appreciate a little bit of patience. We are currently updating our website, and the links to our document library are some of the final things to update, so it may take a day or two before the links we provide you actually function. Hopefully that's not the case, but just wanted to prepare you.
Do we have any other questions from anybody? We have a couple more minutes. Thank you for attending this webinar, Lois. So while I'm waiting to see if there are any more questions, I'll let you guys know that we are recording the webinar. The technology we have records audio and PowerPoint, so you won't get to see Matt and Frank's faces again, so good thing you showed up. But we will send a link out to all of our stakeholder groups with the webinar and the additional links that have been requested. And please feel free to provide us with feedback about the webinar. This is something we haven't done before, but as these different rules come up with kind of what feels like breakneck speed, we want to make sure that we're coming up with different methods for stakeholders to stay informed and to provide feedback. So let us know if this works for you.
And if there are other ideas that you have related to the services that Dell provides that you would like to see discussed in the webinar, we are all ears, because we'd like to keep both to make sure we're hearing feedback from the field, but also that we're keeping folks informed. So if there's other things that you'd like to have us present in these webinars, we would love to do so.
Somebody asked if they'd be able to print the PowerPoint, and what we can do is send a link of a PDF of the PowerPoint along with it. I don't think you can print directly from a recording of the webinar, but we can send a PDF. Joel, your whole question didn't show up, but if you want to put, oh, here we go. Any thoughts about qualifying parents based on annual income rather than the last month or two? Seasonal working families often don't qualify, though they're well below 200% for the year.
So we are looking hard at providing more concrete rules around when DSHS considers a full year of income when they make a determination whether the family qualifies. Right now the rules say that DSHS can consider things like tax returns, which we suggest that they look at a year, but my understanding is that the practice in the field is a little varied, and we could perhaps be a little more consistent. There are always winners and losers when you determine ways of looking at income. If you're looking at the most recent 3 months for a family that struggled in the last 3 months, they might qualify, whereas a year-long look might not qualify them. So the question is how we apply a concrete rule in a way that's equitable to everybody, but it's certainly something we're looking at closely.
Thank you. Ginger, I don't have your full question here. If you want to go ahead and maybe hit enter again on what you typed. And then I think after that we will be wrapping up.
There was the question that I probably misheard. I could give it another shot.
No, I think
Okay,
I reincorporated that.
I didn't want to leave anybody hanging.
Yes. And if you do think of questions afterwards, feel free to respond to the email with the link, and we can do our best to answer them. Okay, Ginger, your question. Will we be able to request payment via online instead of phone?
So this is regarding providers invoicing for care and subsidy. We're in discussions with DSHS regarding potential modernizations to the Social Service Payment System, SSPS, that potentially could include something like that. I don't want to make any promises, especially not on DSHS's behalf at this point, but we definitely recognize that invoicing could be a simpler process and more user-friendly. SSPS is what they call a legacy system. It's old. And so it's not the most user-friendly interface. I think everybody is aware of that, and we're looking actively at ways to update it.
There was a flurry of seconding of that desire, so I think we're aware of that need.
I think that by any view, the current process that providers are asked to go through to submit their billing is not appropriate. It's a terrible waste of their time. It's a waste of the state's time to process the things that are submitted. And so we are looking at, as Matt said, both some fixes potentially to SPSS, but also some technology that we might be able to use for providers just to ease their reporting. And we're looking at all of that. Hopefully we'll see some of that perhaps reflected in our decision packages coming up here this fall.
Great. And with that, I'm going to stop the webinar, and please do look out for a link to the recording and the additional links and documents that were discussed here. And thank you, everyone, for taking the time out today to attend and ask very thoughtful questions.
Thank you all for your service.